capital in a chokehold. Lancet chief unmasks India's inaction. Lancet flags 15 lakh pollution deaths. Government says no link between pollution and deaths. Is government denial costing lives? Delhi Airpocalypse, top focus on 5 Live.
Hi there, this is 5 Live. I'm Sonal Mehrotra, Kapoor. Now, the capital's AQI went up to 1,000 over the weekend. GRAP 4 was implemented, but is it now too late to even begin to solve the problem? Lancet says 1.5 million lives are lost because of air pollution. Our parliament says 0. Also, lots of doctors have come out to say directly linking all the deaths and ailments to air pollution. Our parliament again says nothing about it. So what exactly is happening? What's the truth? That's what we'll decode over the next 1 hour. First up, the headlines. Days after the Goa nightclub tragedy, the Luthra brothers will be brought back to India tomorrow. They will land in Delhi, where Goa cops will take custody. A massive political storm has erupted over shocking slogans raised at a Congress rally in Delhi. Modi, Teri Kabr Khodegi chants by Congress worker. One particular one have triggered outrage, with the BJP calling it hate speech, not dissent. As the Congress held a massive rally in Ramlila Maidan against alleged vote chori, its own leader Mohammad Mokim questioned the stance and blamed the leadership. He's now been expelled. The BJP has appointed 45-year-old Nitin Nabeen as its new working president. He is currently a minister in the Nitish Kumar government. Before heading to Delhi, he offered prayers at the Hanuman temple in Patna. Celebrations turned into horror at Sydney's iconic Bondi Beach on December 14, as a deadly terror attack claimed at least 16 lives. Visuals show 2 shooters firing bullets at fleeing civilians. It has now emerged that the 2 attackers were father-son duo of Pakistani origin. Shocking sexist remarks by a CPM leader in Kerala have triggered outrage and raised questions over the left's claims of progressivism. CPM leader has now said that women are married to have sex and that married women should stay at home and must not contest elections also. This is the CPM leader, Said Ali Majid. The union government has circulated a draft bill in Lok Sabha proposing a sweeping overhaul of India's rural employment framework. The draft seeks to repeal the Mahatma Gandhi National Rural Employment Guarantee Act and replace it with a new law aimed at reshaping rural job guarantee. After 8 months of investigation, the National Investigation Agency is set to file a charge sheet in the Pahalgam terror attack before the special NIA court in Jammu. The charge sheet is expected to expose the mastermind behind the Pahalgam terror attack. Apocalypse continues in the national capital and air quality remains in the severe category. The worsening pollution was visible from early hours, even through the weekend, as dense smog also, dropped temperatures engulfed large parts of Delhi NCR, reducing visibility sharply. And Lionel Messi's India tour has mesmerized fans across the country. After an overwhelming reception in Mumbai, the football GOAT is now in Delhi, where he has an event scheduled at the Arun Jaitley Stadium as the final leg of the tour, even as AQI hits 500. Welcome to the national capital, where the air that you and I are breathing is officially off the charts. The AQI has crossed 1,000. Every breath is doing damage. Schools have finally been shut. Offices have been told to work from home, at least on paper. Hospitals are filling up with breathless patients. Doctors are issuing most extreme warnings yet. If you can leave the city to save your life. And yet, people who run this city and this country do not appear to see it as an emergency. There is no all-party meeting, no emergency session of Parliament on air pollution. In fact, there is no time-bound action plan in place. The Parliament hasn't even found the time to discuss air that is choking the national capital. But what has moved fast? Well, that's definitely the new AQI standards, new definitions, as if Indian lungs function differently from the rest of the world. This is, by the way, on your screen right now, not fog, not winter haze. This is smog. This is the deadly PM 2.5, which is a public health disaster unfolding in real time. The weekend that just went by, the air quality index in the national capital had peaked to a staggering 1045 in certain places. This morning too, Delhi registered levels that were above 500 in several places, remaining sort of firmly in the severe category. The worsening pollution was visible from early hours, and the dense smog combined with dropping temperatures engulfed large parts of the city, sharply reducing visibility and worsening our health risks. Supreme Court, meanwhile, has now taken note of the rising pollution levels. The top court slammed Delhi NCR government, observing that states fail to act unless the court intervenes. The matter has now been posted for hearing on Wednesday. We wait to see what really will come out of there. But the Chief Justice of India has also advised hearings be conducted through a hybrid mode, given the hazardous air conditions. Even the official schedules have not been spared. You just saw visuals of Prime Minister Narendra Modi. His departure for a three-nation tour of Jordan, Ethiopia and Oman was impacted by poor visibility at Delhi airport. The Prime Minister was scheduled to leave at 8:30. The flight could not take off till about an hour or so. Flight operations, in fact, across the national capital region continue to be disrupted. Airlines and Delhi airport have issued advisories warning passengers of delays and cancellations. As of now, 68 flights have been cancelled, 5 diversions have been reported in Delhi airport, and, well, that's just for starters. We don't know how long the situation will actually continue. Children, the elderly, and those with respiratory conditions have been advised to take special precautions and avoid outdoor exposure. The IMD, the Indian Meteorological Department, has issued another fog alert. There is a strong possibility of dense and very dense fog in parts of Uttar Pradesh, Madhya Pradesh during the morning hours of 16th and 17th. Dense fog is very likely in parts of Punjab, Haryana, Chandigarh, Delhi during the same period. In fact, similar conditions are expected in Himachal Pradesh. So December said to be the best part and the best time of the year here in Delhi NCR, clearly turning out to be the most toxic. And make no mistake, what Delhi is battling today is not just an air emergency that has erupted. This has been in making for at least 2 decades. This is toxic air, this is policy paralysis, and this is a crisis that continues to deepen when accountability remains dangerously thin. So what's the way out really? Well, number one would perhaps be to acknowledge the problem and figure out a plan, but the government has refused to do so. The government in Parliament actually went out to say that no deaths took place because of air pollution. This when doctor after doctor and experts after expert, including the Lancet report, went out to say that 1.5 million people in India died because of air pollution. So what exactly is the truth? Why is the government saying zero? Well, to talk to us a little bit more about that, I'm very glad to have the Executive Director of Lancet Countdown, Dr. Marina Romanello, join us here this afternoon. In fact, from United Kingdom. Thank you so much, Dr. Marina, for giving us your time. My first question really is this. Your report went out to late very simply that 1.5 million people have lost their life directly because of air pollution. This when in India, forget a solution, the government on the floor of the parliament, on the floor of the house just last week said that 0 deaths can be linked to air pollution. What's the truth then?
Well, thank you so much for having me. And first of all, my heart goes to everyone in India that is breathing this toxic air. I hope everyone manages to keep safe. As you just mentioned, our recent Lancet Countdown report, which I should say is the product of over 100 researchers that are experts in various fields of climate change and health, including air pollution, have concluded that poor air quality coming from human sources of air pollution in India has caused, and I'm going to correct the number you just said, has caused 1.7 million deaths from human-caused air pollution of all sources in India alone. The latest data that we have is for 2022. And I should say, we're doing this with big data from satellites, from sources of emissions, from big atmospheric models, because actual data being collected on the ground in India is so scarce, which means that the number could actually be worse, particularly when we're seeing these big sharp peaks in air pollution and these, as you said, off the chart levels of air pollution locally. And that obviously those associated links are very robust, have been epidemiologically shown to be occurring all around the world, including in India. So there is absolutely no doubt that poor air quality is linked to millions of deaths globally, deaths in India as well. And aside from death, a huge amount of disease and exacerbation of underlying health conditions, putting people's lives at risk.
Well, what's shocking me right now is that you're saying that this could be an underrated number, an underestimated number. The actual figures could be much worse. But I'm trying to wrap my head around this, because while you say 1.5, 1.7 million, the government of India actually says 0. They're not stopping there. They are going out to say that air pollution levels, what WHO has is just an advisory. India needs to have its own AQI levels. What's your thought on that?
Well, look, one problem with air pollution is, as we always say, it's a silent killer. And what is true, that this is perhaps what the government is leaning on, is that there's only, to my knowledge, one death certificate in the world that links a death to air pollution in the death certificate. That is little Ella in London. Other than that, it's a risk factor, it's an environmental risk factor. And what people will be dying of in the death certificates is, for example, of a stroke, of an ischemic heart disease, is of cancer. But all of these diseases are linked to air pollution. And those deaths might not have occurred if it were not for the chronic and acute exposure to very high levels of toxic air pollutants. So while you won't see it in the death certificates, the underlying cause we know is there, is that environmental, as we say, risk factor for deaths. And the WHO thresholds are there to help countries protect their populations. There are thresholds that come from studies, from scientific studies, linking air pollution with deaths, with disease, and finding what is considered a relatively safer threshold. And I say safer because there's no safe level of air pollution. Air pollution accumulates in our body, causes chronic conditions like cancer, like cardiovascular disease, it's linked to diabetes, it's linked to neurological diseases, to cognitive diseases. So therefore, ideally, we won't have exposure to air pollution, but the lower the better. And that's why the WHO thresholds are there, to protect the populations. They're scientifically grounded, and they're the target that all countries should be aspiring to meet. Obviously, those targets are political targets, and India is decided to put a much higher threshold from what I hear. Unfortunately, that would mean that the diseases facing people, the level of damage caused by air pollution will be higher than it would have been otherwise if those international standards were respected.
Right. Is there any other country, Dr. Marina, that has their own sort of separate AQI monitoring system, the one that India is proposing to have now?
Well, I know that the WHO targets are targets that all WHO member states will be looking for and will be trying to work towards. It's also important to know that those targets are ambitious because that's what we need to protect people's health and people's lives. And in many countries, those targets are still being exceeded. It's a target that is there as a goal to protect the population. But the important thing here is to work towards that goal. As I said, many countries will not have met those standards either. But setting a target that is so much higher than what the WHO recommends talks about the aspiration to protect people's health and people's lives. And as I said, no level of air pollution is safe, let alone levels that are higher than the WHO's recommendations.
Right. Dr. Marina, while we speak, we've been covering this issue non-stop here on India Today. Every day, perhaps for the past 1.5 months, we've discussed air pollution on the program. The coverage in the media has gone on for decades at length. But we have somehow not been able to find a solution. It is sort of in India, to give you a perspective, become just another inconvenience that you perhaps live with. That air is just bad, and it's like living with traffic. We'll just live with bad air. For those who are still not convinced, what do you say, especially to our parliamentarians, especially to our bodies who are supposed to sort of work on this? What do you have to tell them about the gravity of the situation we are in as of now?
Yeah, look, poor air quality has affected many countries and continues to affect many countries. But the important thing is that our understanding of just how harmful poor air quality is to health has increased enormously over the past decade. We know now that it's one of the main causes of death and disease globally. And we know how diverse the impacts are, from acute impacts like respiratory infection, like exacerbation of asthma, to chronic effects like cancer, like obstructive pulmonary disease. And that understanding means that we cannot turn a blind eye. And what's perhaps most important here is that there's so much that we could do with immediate benefits to the air quality everywhere. To give you a sense of where this air pollution is coming from, about 750,000 of these deaths from air pollution in India come directly due to the burning of fossil fuels. And that comes from sources of energy that could be replaced with clean air quality. And India has the best natural resources to replace coal, that is such a dirty fuel, liquid gas, with clean energy technologies. And India could be a superpower in clean energy. That is, of course, the energy of the future. Stopping to burn fossil fuels, particularly in urban centers, particularly close to where people live, could have immediate benefits, could save thousands and thousands of lives every year. And we've seen globally 160,000 lives are being saved every year due to phase down of coal burning, particularly in Europe. There's no reason why India should not benefit from that cleaner technologies and cleaner air quality as well. And that could save, as I said, hundreds of thousands of lives every year.
Got it. Dr. Marina, when I speak with doctors on this issue, the one thing that they tell me very clearly is that smaller kids whose bodies, whose organs are still developing, and older people are the most impacted. Do you have a sense of what kind of impact do you see? You're right when you say that it's a silent killer. So the impact is not immediate and sometimes not permanent either. So to take that into account, could you tell us what exactly is the level of damage or permanent damage that happens to younger kids especially and to older individuals?
Yeah, so look, when we talk about air pollution, what we're talking about is these very, very tiny particulate matters, particularly when you talk about PM 2.5. They're really, really tiny particulates in the air that we breathe. These particulates enter our lungs and generate damage there. They're highly harmful to our respiratory system, particularly harmful for kids, for young children whose lungs, whose organs are still in development. So we see, for example, exposure to air pollution linked to higher incidence of asthma, with higher incidence of asthmatic attacks and death associated with asthma, similar with, for example, pneumonia or other respiratory infections. So that's when it comes and stays in our lungs. But this small particulate matter goes through our lung barrier and straight into our bloodstream. And that is why it's so harmful. It will be distributed throughout our body. And as such, it affects practically every single one of our organs, from our heart to our liver to our brain, will be affected by these toxic pollutants that are in our blood. And imagine what that does to a young kid whose organs are still in development. It will affect them throughout their lifetime. And oftentimes this air pollution comes also with carcinogens. Those carcinogens will start generating damage in our cells, will start generating mutations, and the more they accumulate, the worse it is for our organs. So when children are exposed from such a young age, we're basically condemning them to a life of increased risk factors for very deadly and very nasty diseases like cancers, like cardiovascular diseases, like chronic respiratory illness. And that gets worse as the air quality worsens and as the days of exposure become more. So that the accumulation throughout a lifetime, they will pay for that damage all throughout their lives. And that is why it's so important that very robust measures to tackle poor air quality are taken today.
Yeah. Give me a sense, Dr. Marina, of what would other developed nations do when air quality reaches these levels. India, after all, is the fourth largest economy in the world. We have a lot of development goals to meet. We are also a very complex nation. We are divided by color, by language, by different temperaments, but we've always thrived in the fact that we are different. Even geographically, we are very, very different as you move, even say 10 kilometers, down the terrain in India anywhere. So keeping all that in mind, India is a complex problem, but what would you suggest be done as of now when pollution levels, AQI levels are over 1,000? And what would you say is that other countries would do in this situation?
Yeah, look, as you were saying, this is an emergency, right? We cannot be breathing air that is this toxic. So stopping people from being exposed to the outdoor environment when the pollution outside is so high is fundamental. Telling people not to go to work, not to use their cars that is so polluting. One of the main sources of air pollution comes actually from the use of petrol in our cars. So stopping car traffic, stopping people from going to work, from being exposed to poor outdoor air is essential at the emergency mode. Obviously, that comes associated with big economic costs, with cost to people's income as well. And to avoid those damages to the economy and to health, you need to take robust measures to do long-term changes in air quality standards and in air pollutant emissions. That looks like improving air quality standards for road traffic, transitioning away from the use of petrol-based vehicles towards clean public transport and active travel whenever possible. Transitioning away from the use of coal. Coal is still a very expensive fuel. It's highly, highly contaminant.
But what would other countries do? We know, for example, Mexico City has been in this position. London has been in this position. Beijing, China has been in this position.
Well, look, I can tell you a bit about London. That is where I live. We have now a clean air zone in London that restricts traffic. As I was saying, restricting road traffic is essential. Changing our buses to electric buses to avoid that big level of air pollution is essential. We now restrict polluting vehicles in almost all of London, and we restrict traffic in highly dense and urbanized areas in London as well. That doesn't mean that London has the perfect solution. We also have really high levels of air pollution and associated deaths. But there has been a lot of progress. We're, for example, banning in certain parts the use of biomass burners. This is wood fire ovens, because we know that burning wood is also highly pollutant, so we cannot afford it. We have to turn to cleaner energy sources, and transitioning away from fossil fuels towards clean energy is the most effective way of avoiding these deaths, and that's what many countries are doing. China is a great example of it as well.
My last question, Dr. Marina, is this, that why do you think India has not been able to solve this problem, which has been going on for about 2 decades now, more actively for the past 1 decade at least? What do you think is holding us back?
Look, I think it's very complex. You will probably know more about this than me, but India is highly dependent on coal, for example, for its energy grid. I know that coal is locally available. There's no need why it still should be. I think that's a political failure to transition towards cleaner energy, to cleaner technologies. The same with urban traffic. Highly polluting vehicles should not be allowed in the city center. And that comes down to political will and political incentives to clean air quality. I think sadly has not been taken as the priority it should have. As I said, it's not just about health, it also costs the economy enormously when you have to shut down a country or when people cannot go to work because they're sick due to a respiratory disease. We're seeing women cooking with dirty fuels inside their home, high levels of energy poverty. So I think this is a very complex situation that has a lot to do with development and with cleaner energy access and with tackling energy poverty. But I think India is now in a perfect position to tackle this issue. It's a country that is growing so fast, that has such a thriving economy and population as well, that there's no reason why it should be delayed any further.
Very quickly, Dr. Marina, the government has rubbished the numbers from Lancet. They've gone ahead to say that no deaths took place at all. What is your response to that?
Well, as I said, the death certificate we're probably not saying, but these numbers are undeniable, are robust. There's numbers from other researchers that are even higher than our estimates, which I say we try to be conservative, to be always on the safe side of what we're saying, because we know it has political implications. But there's absolutely no doubt, no epidemiologist, no medic will tell you that air pollution does not cause health issues and deaths. So these numbers are robust. We do need more action, and I hope that the Indian government will also start monitoring air pollution to be able to give evidence-based and very robust responses to the local population.
Dr. Marina, thank you so much for all the work that you do, and thank you so much for giving us your time as well.
Thank you, and all the best to everyone over there.
All right, that was a Lancet chief saying the government should not be waiting for a death certificate to say that it's directly linked to pollution, like it had confused in the case of COVID as well. Also saying political will seems to be lacking in this matter. But let's get a live update now. I have reporters and my colleagues joining me from across the National Capital Region. Shivani Sharma joins us from Anand Vihar, one of the worst polluted places in the National Capital. Anmol Bali is at the IGI airport, and Piyush Mishra is also with us for the political perspective on what's really happening inside Parliament. Let me start with Anmol Bali. Anmol, lots of flight cancellations took place today. Even Prime Minister's flight had to be delayed. What exactly is the current situation?
Sonal, as you know, due to smoke, many flights have been cancelled, delayed and diverted. Currently, I am here at the IGI airport, and today, due to the smoke, it was seen that more than 60 flights have been cancelled. Around 250 flights have been delayed and diverted to other airports due to the smoke. And currently, I'll show you the visuals. Currently, the condition of visibility is improving, but yeah, Cat 3 has been implemented by the airport authority. They have also issued a statements to the passenger that if you are coming for your journey, read about your schedule, read about your flight, and then you start your journey towards the airport. So this is the current condition at the IGI airport, and according to forecast also after 10 we could also again see that a thick layer of smoke will engulf the national capital, which could impact the airport operations as well as rail operations around national capital.
Right, so that's at the airport. Flights and trains both impacted over there. Shivani Sharma is here with us. Shivani, I see you at a foot of a bridge over there to give us a glimpse of the visibility being absolutely poor. But give us an understanding of what are people on the road saying. Through the weekend, we've had so many people fall sick. There are doctors who are saying that now their emergencies are being flooded with people who are coming with chest congestion, younger kids as well. What's your understanding?
Sonal, I'll keep giving you the pictures because, pictures speak louder than words. We know that we are in National Capital Region, and Anand Vihar, that happens to be one of the most busiest bus station, the junction where 2,000 buses operate each day, not only the DTC, the interstate buses. And after the Grab 4 implementations, there are guidelines that the old diesel buses should not operate. But we do not visibly see any cut down in the numbers. The traffic is as usual on the road. There is the visible smog, the pollutants that are making the air poisonous here. And when we talk about Anand Vihar, Sonal, this is the place which happens to be one of the most polluted areas of national capital. The air quality index here ranges from 250 to 749. So you can imagine the kind of poisonous air the people out here are breathing in. This is the slow poison that everyone in Delhi is forced to take in, to inhale. And why this Grab 4 was implemented so late, this has to be answered. We see one or two sprinkler vehicles out here, but how much difference can these vehicles make is a big question. Another very important thing is that there are enforcement issues too. When GRAP 4 is implemented, there are strict directions that the schools, especially for the younger children, should be operated in hybrid mode. But there have been complaints that a number of schools in this area, they have not declared holiday for these children. So who is at fault? When we ask questions, they say that they did not receive the messages on time, and there are enforcement issues in the national capital as well. So you see, people who are here, they are the travelers who are in transit mostly. They are going from one state to another. There are buses lined up out here. They are forced to go because they cannot stop their lives. But there has to be some strong implementation, especially when it comes to the GRAP 4 measures. The number of buses you can see out here, the visible pollutants in this air, which is quite unusually high at this moment too, because in the morning it is maximum due to the temperatures, then through the day it settles down, but right now it's still visible. So you can imagine the kind of pollutant layer which is there in Anand Vihar area, which happens to be one of the most polluted air, when it comes to air pollution, one of the most polluted areas in Delhi. But people are out, they are going, they are not, they cannot stop their lives. That's
but very
what they
importantly,
say. But
I
yes,
think,
they are
Shivani, the
forced
most
to
important
deal
point that you've
with
mentioned right now has
this
been that of implementation of GRAP 4. And I think that's something that we really need to question the government on. Why is it that GRAP 4 was implemented late and now the enforcement is barely there? You see traffic as usual, at least in the morning that I saw while coming to office, and now even behind you, it seems absolutely usual. There's nothing, we don't see cut down in that 50% that we, used to see in early years. So that's something to, look out for. All right, that was a very important point there that Shivani raised, and let me take that with our guests forward now. Joining me now is Dr. Sanjeev Bagai. He is the chairman at Nephron Clinics. Also with us is Chandra Bhushan, CEO, International Forum for Environment, Sustainability and Technology, iForest as it's called. Dr. Bagai, the first question really is to you. I don't know about your weekend, but the weekend that just went by got so many people sick. So many people run to the hospital, and what I am hearing at least is that the numbers, when they crossed 1,000, that's when you immediately saw an impact of emergency rooms. You immediately saw patients sort of trickling in. What was your experience?
Good evening. I think this is a healthcare emergency in the national capital. There is no question about it. We have framed our rules of putting the GRAP measures in different grades to suit our convenience. Then the international AQI, which is recommended by WHO, is 15 and below. India has accepted 50. Okay, that's fine. But according to me, health hazards kick in anything more than 100 to 200. If you're going to wait for 400 to 500 to kick in and then bring in the measures, it's too little too late. Let me explain this in layman terms. This AQI is a reflection of various components of the air pollution, which is mainly PM 2.5, PM 5, but not to forget micro nanoparticles of plastic, hydrofluorocarbons, volatile organic compounds, toxic gases like methane and so on, including ozone. These are filtered down in ultrafine particles. They break through your lung barrier and enter the bloodstream and go to every body organ. There is almost an 80 to 100% increase in lung cancers, brain cancers, kidney cancers, liver cancers, and so on in the last 10 years to 15 years. We've seen acute respiratory problems, including bronchitis, pneumonias. Children are more affected, especially because they breathe twice as fast as adults. That means they take in twice the volume of the pollutants. Apart from that, we must understand that 20% underestimation of the AQI is an accepted norm because the PM 2.5 aggregate as larger particles is called as an aggregating factor. So the real, if it is 500, the real is more than 650. Also, the heavy metals are never being spoken about. The heavy metals, what they do is they catalyze the micro nanoparticles of plastic, make them into super ions, and these damage the body even more. So we need to look at this in a more holistic manner. I have recommended this for a very long time as a simple tax-paying citizen, that we need a separate ministry of clean air. This is our fundamental right. If we want to reach the dream of being Viksit Bharat and a really strong nation by 2047 or earlier, we cannot achieve this if we are an unhealthy nation. Make no mistake about it, this is damaging the pregnancies, damaging the fetus, congenital birth defects, including absent limbs, cleft palate, congenital hearts, absent kidneys. It damages your DNA. That means your next generation is going to be born with more amount of chromosomal defects. This is all published data. There is some whispering in some corridors that all this is not correlated with the Indian study. So just in 60 seconds, let me pan it out. Sorry for my cough. This is a gift from the air. That there is more than 7,000 articles which have been published internationally, out of which more than 250 are only India-based. Lancet July 24, Lancet Jan 21, Lancet December 22, Lancet December 22, Lancet July 22, BMJ, British Medical Journal in November 23, New England Journal of Medicine 11/22. These are all published on India meta-analysis of 10 cities, 21 cities. Some are only based on Delhi. The fact is, even a 10 microgram increase in AQI of PM 2.5 gives you a 200% increased risk of either having a heart attack or a stroke, obesity, diabetes mellitus, metabolic disturbances. One notch higher of 22 AQI increase is equivalent to smoking one cigarette for a never smoker. That means with this AQI, on a daily basis, people who've never touched a cigarette are smoking up to 25 to 30 cigarettes a day. So in my language, it's called as welcome to the Marlboro country.
Dr. Bagai, I hear you. I hear the cough, the pollution cough in your voice. I hear your frustration. I hear your almost breathless list of things that is going to happen to us and the generations that follow. But somehow the politicians are not hearing you. Somehow our ministers don't care enough about AQI. Somehow they are perhaps in filtered air, and that's why it's not impacting them. And for some reason, this is just not knocking the right doors, which is really, really sad. But let me bring in Chandra Bhushan at this point. Mr. Bhushan, the last weekend is where a lot of people who were saying, "Arey, ye to bas hawa hai." A lot of people who in India have now discounted air pollution as just another inconvenience that you live with, right? Like you live with bad traffic, or you live with like bad water and you have to purify it at your own house. You just live with bad air. Like that's what a lot of people had sort of given up, and that's what they were living. Last weekend changed something. Friday, Saturday, Sunday, when numbers went above 1,000, something happened. First up, could you tell us what is your own analysis on forecast for the days and weeks to come? Remember, the days and weeks to come are going to be filled with Christmas parties and New Year end parties. There'll be catch-ups, there'll be weddings and receptions, there'll be a lot of gathering and also a lot of traffic on the road.
So we are right now in one of the worst meteorological conditions that you can think about. The wind speed is very low. You have inversion. You have high moisture, therefore you have fog. And it is both because of local conditions as well as the conditions from western disturbance. So what you see today is one of the worst meteorological condition, clubbed with major pollution sources from everything. Whether it is traffic, it is heating and cooking fuel, industries, dust, everything has come together. And therefore you have such poor air quality. Next couple of days, the predictions are that the meteorological condition is not going to improve significantly. So you will have poor air quality for a couple of days. Let's now pray for gods to give us higher wind speed or maybe a rainfall to clear this up. No measure of GRAP can reduce this air quality, improve this air quality. I want to say it upfront. There's enforcement challenge of GRAP. I saw one of your reporters at Anand Vihar and how difficult it is to enforce. So one is enforcement challenge. Second is, even if we are completely implementing GRAP, will it get us very clean air? Most likely not. It will reduce somehow, but not significantly. So air quality in Delhi will not be improved by such emergency measures as GRAP. We have to start thinking about air quality improvement year round and start thinking about all sources of pollution. Start thinking about the entire region. It is not Delhi's problem alone.
Yeah.
You go to Noida, you go to Gurugram, you go to Aligarh, Meerut. You think
In
about
fact, let me go beyond that. It's not just Delhi, NCR, it's 60% of the country. 60% of the country has bad air. And that's the reality of the day. That's what we're dealing with. That's what
the
we're
worst,
dealing with.
you
I
take a
really
day-
wish I had more time, Mr. Chandrabhushan, but I promise I will not leave this issue. I promise we will come back to you and we will pick up different layers of this entire air pollution fiasco, emergency, that we've been talking about. But I'm really sorry, that's all the time we have at the moment. Quick wrap, and we will see you again tomorrow. Bye-bye.